Greetings, friends, and thanks for coming back to see us here for Dr. Brent and Coco Season 4 as we continue to travel through our RSV miniseries. I hope that everyone enjoyed their turkey and uncomfortable conversations for the holiday yesterday and you didn't mind me taking a day off. Hope you have some leftovers to enjoy. I mean, like leftover food, not leftover feelings. Anyway, today, I wanted to help you identify the groups who are at highest risk for severe disease. Worldwide, some studies estimate that there are 33 million RSV-related infections every year, with 3.2 million hospital admissions and between 95 and 150,000 deaths. That's worldwide, not in the United States. Obviously, it's not easy to get accurate counts from all over the world, but the good news in the US is that we have resources to deal with the worst cases. On average, we have historically only seen 100 to 500 deaths per season in children with RSV. Prior to pandemic, 5 out of every 1,000 children under 5 were hospitalized for RSV. At this point in our current season, our rate of hospitalization for kids under 5 is over 7 times that rate. We know that there are a few groups who are at higher risk for severe illness. One group is infants under 6 months of age. I've admitted babies to the hospital for RSV who are under 2 weeks old, and that's kind of scary for parents. Compare that with the current hospitalization rate for RSV in kids under age 5, which is 36.3 for every 1,000 children. The rate for our babies under 6 months of age is 145.2 per 1,000, compared to around 30 in years past at this time in the season. Preterm babies born at 30 weeks gestation or less were 3 times as likely to be admitted for RSV than term babies. So we know that our youngest babies and the preemies are at higher risk. In addition, any child who was born with chronic lung or congenital cardiac conditions are at higher risk as well. For those patients, changes in their baseline heart or lung function can really cause them to spiral downward. On the opposite end of the life cycle, it's important to note that older adults are also at higher risk. Each year, between 60 and 120,000 folks aged 65 and older are hospitalized with RSV in the United States, and 6 to 10,000 of them will die. Just like COVID-19, RSV can be really hard on our older adults because they're usually also dealing with chronic medical conditions that complicate their course and have a harder time fighting off infections. Finally, people with certain chronic conditions are at risk. Obviously, respiratory conditions like asthma or cystic fibrosis will be a concern simply because their lung function is already at less capacity than other folks without these challenges. In addition, certain neurologic disorders that cause muscle weakness, like multiple sclerosis or muscular dystrophy, will make it harder to cough and clear infection. Finally, children with impaired immunity due to a genetic disorder or chronic immune suppression due to medications they routinely take will all put patients at higher risk for severe disease. So, as expected, the very young, the older adults, and those with chronic underlying conditions are the general categories of folks who may not handle these infections very well. We will go over preventative measures in another video, but it's very important that if you are around someone who is at higher risk or in a higher risk category, that you know how to protect them in every way possible. That's enough for today, my friends, but this is a great opportunity to put a plug in to encourage everyone to make sure you're up to date on your immunizations, including your yearly seasonal influenza vaccination and your most recent COVID booster. You can scan the code on the screen to visit vaccines.gov to search for the location nearest you that is offering vaccinations. You just put in your location and the vaccination you're looking for, and it'll give you an easy list. For some locations, it even provides a link to sign up for a vaccination appointment. Easy as that, and you protected yourself and everyone around you. Until next time, my friends, get those seasonal vaccines and boosters, you animals. See you soon.